Good morning. I'm Ray Jones, Pike County Judge Executive, and we're here today to give an update on the COVID-19 situation here in Pike County and to talk about the reopening of government services and the need to keep maintaining our social distancing policies and our hygiene policies. We have a lot of issues to talk about. We're going to try to do this in a short time period. So without further ado, I'll pass it over to Ms. Tammy Riley, who is the Public Health Director for the Pike County Health Department.
Hello, and thank you, Judge, for allowing us to get together and discuss this very important topic. From the Health Department's perspective, what I thought I would do today is provide an update on the numbers. This slide that you will see from the Health Department is on our website, pikecountyhealth.com, and it shows an update on numbers. We currently have 38 cases. We have 33 confirmed and 5 probable from serology. And you can see from the slide that of those 38, 2 are deceased, 28 have recovered, and 8 are active. So the nurse administrator, the regional epidemiologist, and those teams are working with those individuals. If you look at the second slide, it shows the pattern of how the cases presented themselves in Pike County from starting from late March to today. So if you look at Memorial Day, we all know that Friday prior to Memorial Day, which was May 22nd, that our economy, and we're going to talk a lot today about the economy and society in general, the reopening of our activities and the economy. And it was really important to the citizens that occur, but we want it to occur safely. And what I wanted to show you is that on May 22nd, in Pike County specifically, we had 28 cases. 23 were confirmed and 5 were probable. And what we have seen, and we knew we would see more cases as the economy opened and our activities and behaviors, regulations rather, were relaxed. So we knew we would see an uptick in some cases, and we have. And I just wanted to show the citizens that since that May 22nd date, when restaurants reopened at 33% capacity, individuals were attending church in person, things of that nature reopened or relaxed, we have seen 10 additional cases in Pike County. And you can see on the chart that from May 22nd until June 6th, we've gone from those 23 confirmed to 33 confirmed. So we've seen 10 confirmed cases. So we are seeing a steady, it's slow, could have been worse, but we are seeing a steady uptick of cases. So I just wanted to make everyone aware of that. What we don't want to see is a spike. So we wouldn't want to see 4, 5, 6 cases a day. If that started happening because of the exponential factor of how this spreads, we could get in trouble very quickly. And when you look at the third slide, it shows the Healthy at Work timeline, and it shows that May 9th date when places of worship opened. You can see the May 22nd date on there. But what probably is most important to all of us are these dates that are coming up. This past Monday, June 8th, several things opened. Some child care, for example, that was very important to us so people could go back to work. We needed child care. So on that date, child care reopened. June 15th, June 29th, those are some big dates coming up with youth sports. Can start practicing on June 15th. On the 29th, they can start competing with 50 or less spectators. But that will only happen if we continue good behaviors, good personal hygiene, as you referenced, Judge, washing our hands. Probably most importantly of all is practicing good social distancing. When you're in confined areas indoors where you could become in contact within that 6 feet of others, wear your mask. We all have our masks today. We took them off to speak, but we have our masks. So those behaviors and practices are more important now than they ever have been, the same as they were important when we started talking about this in March, because we want to see those dates. We want to hit those benchmarks, June 15th, June 29th. I want to be able to see us do some activities where 50 or less can gather, and we can do it safely. So I just wanted to provide that update for the citizens.
All right, thank you very much. Doctor?
All right, good morning, everybody. Thank you, Judge, for inviting us today to talk about COVID-19 and about the situation here. And again, the goal of this committee is to give you knowledge. And we need to empower you with all the information needed to do your part. And again, our goal is to keep this area safe. We need to sustain economy. We like to open, but most importantly, we like to sustain that economy because we don't like any kind of drawback or any kind of lockdown. This is not the intention. So the goal here is to give a positive message. We need to move forward. We need to enjoy summer. However, we have to be vigilant and careful with all the activities that we were doing. And I put online a video about the summer activity, and I think it's like nice video to educate the public how to do it safely and how to take that opportunity, COVID-19 situation, and make it into an opportunity to enjoy summer. But I want to basically touch on what Mrs. Riley said, that over the last 2 weeks, we have 25% increase. And this is something a little bit like cumbersome for us because, as I mentioned multiple times, that the activity is going to gauge the pace of opening. To go from a phase to another phase is completely contingent to the activity. So the more we see activity, the more we have to be very careful with reopening. However, if you keep your wits around you and be careful with whatever you're doing, I think it's going to be the safest way to open the economy, enjoy summer. And I think the summer is for our convenience because we know that temperature, humidity is going to help us tremendously calming down the growth of the virus and decrease the spread of the infection. However, if you want to choose, you can pick outdoors versus indoor. This is very important because if you look at all the studies, the virus is about 4 items: about the people who could be infected, not infected, about the time, how much time you go face to face with that person, about the place, definitely indoors versus outdoor. I'm going to talk about them like in details, and about the size of the virus. The size of the virus is very important because to get infection, you need to have a size of 1,000 viral load, which is called viral particles. And if you talk to somebody, there is a chance to pass 200 viral particles per minute. So worst case scenario, don't spend more than 4 or 5 minutes face-to-face with the person. If somebody is coughing or sneezing, you can push up to 200 million viral particles. And when you sneeze, the same way as well. So anybody coughing or sneezing, we need them to do what's called respiratory etiquette. Please cover your face. Make sure there's no particles will be spilled or expelled to the public or to closed space. But if you need to choose, please choose outdoors versus indoor. It's going to definitely cut down the risk big time. If you want to choose as well, hand hygiene versus non-hand hygiene. If you're in closed space, definitely masking is much better than non-masking. So all these going to help you tremendously to cut down on the risk of the transmission. So if you take into consideration the risk factors, definitely age and comorbidities continue to be a risk factor. So we highly emphasize on these patients who have heart disease, diabetes, problem with the lungs, to be very careful. This is not the same risk like the general population because these people can have the infection and can have the consequences of the infection, and we don't want that. And that's why if you have somebody who's elderly at home, be careful with whatever you're doing. Now, going back to the point that the good news here, our activity still in the area is still low. And I'm talking here from statistical standpoint, from epidemiological standpoint, even when we talk about PMC testing. Till the morning, we've done close to almost 3,700 tests. So we resulted 3,700 tests with only 15 positive. And what doesn't mean that positive test percentage is 0.4%. Anytime you are less than 1% or less than 3%, you are in containment strategy, which is great, we're very blessed here in the area to have that kind of like good news. However, that percentage can vary based on our behavior. So if we are putting down our guards, if we're loosening our behavior, we're going to impact the whole area, and subsequently, we're going to face consequences of that. So here the goal is, enjoy summer, do activities, but please be careful and diligent with what you're doing. So some of the good activity, anything outdoor is very good because you're in the open air, open space. And this will limit the risk like tremendously, like running, exercising outside, tennis, golf, all these are really good activities. Now, when it comes to contact, we're going to talk about a little bit because there is some sort of physical contact with players, and here they have to be very careful. So if you pick your group carefully, I think there's nothing wrong with that. If you know the behavior of the players, nothing wrong with that. But you cannot go to full activity at this point unless we make sure the activity in the area is doing fine. So hopefully by June 28, 29?
29.
29, we'll be able to go to 50 and above. So hopefully we'll be able to do that. But again, we're going to be testing that activity in the area to be able to see if we can move that direction. And hopefully we'll be able to move that direction. Now, water activity is very safe. If you are in the water, there is nothing you're going to catch from the water, because the chlorine and all the hygienic methods that we use in the water, they're going to work very well to clean the viruses, the bacteria, the yeast, and all the stuff. So, however, you have to keep the 6-foot distance in the water as well on land. So this is the key here. That's 6-foot physical separation, what's going to protect you. Anytime you go to indoor, masking is very important, especially when we talk about closed space, when you're talking about the air circulation. So if you cannot maintain that air circulation, this is definitely is going to affect people, and subsequently the infection can be spread. I know the CDC talking about the surfaces are not a major cause of transmission. However, if somebody has a snot, an infection, and basically messing up with the surface, and subsequently you touch that and put it on your face and your nose, this could be as well source of transmission. This is called the indirect source of transmission, and we highly emphasize on hand hygiene and cleaning surfaces. So all these are the basically safe activities to do during the summertime, but you have to be very careful. You have to apply the hand hygiene, comply with CDC guidelines, masking over non-masking, hand hygiene over non-hand hygiene, outdoors over indoor, and hopefully no more spikes, because we don't want to see that. The goal is to not see spikes, because spikes will affect us tremendously when it comes to all the outcomes from economical standpoint and even from social standpoint. Okay, if you look at all the study, there is a lot of anxiety, depression, and a lot of psychiatric illness attached to the COVID-19. We don't want to bring it here. We want to enjoy summer, increase resilience, decompress, increase naturally endorphin without using any medication. This is the goal, and we need to enjoy our life, and hopefully things will go well without any problems.
Can I add that I shared the video that Dr. Fadi made, the Pike County Health Department. It's on Pikeville Medical's website. I would highly encourage everyone to watch that. It's a very short video. It's really well done. It goes very thorough about low to risk behaviors for indoor and outdoor activities. So it's a great guidance for those that maybe are unsure of what would be safe, what's safest versus, in the medium area versus high risk. So it's very well done. Thank you for making that, Dr. Fadi, but it's shared on our Facebook page.
I have one question, in Dr. Fadi. Last week, Kentucky saw the largest number of cases in any single week since the pandemic began. Can you explain why that is?
Basically, if you look at all my videos since day number 1, I've been talking about fluctuation of the cases in Kentucky. We never had any constant pattern. So one day we have high number, the other day we have low number, and that kind of zigzagging or fluctuant rate of new cases would affect the growth rate. And I mentioned the growth rate, which is the new cases today over the cases the day before should be less than 1 to be able to contain that. And this has been very challenging in Kentucky since day number 1, because we cannot draw the right pattern of the growth factor. Now, protesting definitely will have an impact on that, because if you're in the street, you're not protecting the 6-foot distance, you're not wearing mask. So definitely this will affect that, and this is definitely could be one of the contributors to the increase in the spike of the COVID-19, especially during this time. Now, we're going to see most of the results in the next 2 weeks, because we know that the incubation period of the virus is going to be 2 to 14 days. So if this is really affecting us, we're going to have some impact in the next week or so. But this has been a problem since day number 1 in Kentucky, because that fluctuation and the number never been a steady number, and all the time the margin been wide enough to give us some confusion, because it's been a problem since day number 1.
A good example is Saturday. We had our third highest day since the beginning of the pandemic at 319. 65% of those came from Jefferson County. Then Sunday, it was 70-some, and Monday, yesterday, was in the 120s, I believe, for a total of 11,476. So you can see 319 down to 70, up to 120, kind of in line with what Dr. Fadi was saying.
Thank you both. I want to just move on to get an update from Mr. Philip Ellswick, who is the city manager from the city of Pikeville. This week, or actually last week, Mayor Jimmy Carter and I jointly rescinded an executive order that we had entered jointly that limited retail customers to 1 shopping cart per person or 1 person per household. That has been rescinded. And as we try to move forward with reopening the economy in the quickest way we can, but also the safest way that we can. So Philip, if you would just update the folks out there who are in Pikeville or who come to Pikeville for medical appointments or business, shopping, those types of things, where the city is in terms of reopening services.
Yeah, last week on June the 1st, the city reopened their administrative offices. And when I say that, I'm referring to City Hall as well as the Office for Economic Development. All of our staff have been teleworking for several months. All of those staff have come back to the office now, except for a couple that had special circumstances. But City Hall is now open. You can go there to perform whatever service you need. There are requirements in place that you wear a mask, as well as distance yourself 6 feet from other people in the building. All of our staff are wearing masks when they're outside of their office, in public spaces or interacting with the public. And then yesterday, June the 8th, we reopened our parks, playgrounds, tennis courts, things of that nature. We are sanitizing those on a daily basis, multiple times throughout the day. And we're monitoring those to make certain that there are not large groups gathering at various times, and when we do observe that, we let Tammy know so that she can enforce the rules. But it's been very important to us all along that we allow people to still have some sort of outdoor recreation. So our parks per se did not close, just ancillary facilities, basketball courts, tennis courts, and playgrounds. The turf field at Bob Amos Park or at Hambley Athletic Complex has always been open. So we are slowly reopening with a variety of precautions in place, both for the staff and our public.
Philip, thank you very much. On behalf of the Pike County Fiscal Court, our courthouse reopened yesterday morning. Visitors to the courthouse are required to wear a mask and have their temperature taken when they come into the courthouse. And also will be asked if they've had any fevers, any coughs, or been exposed to anyone who has been confirmed to have COVID-19. We have reopened the Grants Branch Park up at on Pond Creek. We are in the process of trying to reopen the other community buildings and our parks and playgrounds. Unlike the city, where we're spread out over such a large area, we simply at this point don't have the manpower to make sure that the facilities, particularly playground equipment, is sanitized multiple times a day. And until we're in a position to do that, we have conferred with the health department. We've, amongst ourselves, we've talked about this. We've looked at the CDC guidelines. We, at this point, do not believe that we are in a position to reopen the parks and playgrounds because we do not have the manpower to make sure that they're clean and sanitized. We have continued to work here in the courthouse. Our staff has worked, some have worked remotely. Most have worked here in the courthouse. We've spaced everyone out. We don't have the manpower and the staff size that we've had in the past, so we've been able to make sure that we have continued to operate county government services. Our solid waste system has continued to operate, which I think has been a positive considering the fact that Lexington, which is a larger area, much more prosperous in a lot of ways, they stopped curbside pickup. We felt it was vitally important to continue our solid waste pickup because of the public health hazard that would be created by not doing it. We also have some other issues I just want to briefly mention. As most people know, the May primary was moved to June 23rd, 2020. That will be when the primary election takes place. We encourage everyone to vote. We are concerned that we're going to have a low turnout. On Election Day, on June 30th, 2020, there will be 6 centralized voting locations throughout Pike County. Those polls will be open from 6 a.m. to 6 p.m. That will be at Belfry High School, Phelps High School, East Ridge High School, Pike Central High School, Miller Grade School, and Shelby Valley High School. If you want to vote with an absentee ballot, you can call the Pike County Clerk's office at 432-6211. You will need to do that by June 15th in order to make sure that you can get the ballot in time. Otherwise, you can go to the online voting portal at govoteky.com to request your ballot be mailed to you. They must, however, be submitted by June 15th, or the requests have to be submitted by June 15th. You can vote here in the courthouse from 8:30 a.m. to 4:30 p.m. through June 22nd. You will not be able to vote here in the courthouse on Election Day. So we encourage everyone to take the steps necessary to make sure that they vote, that they do it safely. The fiscal court has increased the pay for our election workers because of the hazard that they're going to be exposed to. I would, think that it would be, some could legitimately question whether we're better off to have only 6 voting places because it's going to create more people, whereas if we had the normal 52, 53 polling places, it may not have been as bad. So, but those are the places that you will have an opportunity to vote. Also, we are only about 55 or 56% in terms of census compliance. As we move forward to address some of the problems that we have here in Eastern Kentucky, the population loss is one of the largest problems. It could potentially cost us a congressional seat. It likely will cost 1 or 2 House seats from Eastern Kentucky as the population grows in Lexington, in Northern Kentucky, and Louisville. So it's very important, if you've not answered the census, to do that. You can go to the census website. If you've not received a census form by mail, and you can do it online, 10 or 15 minutes, and we're encouraging everyone to do that. So in order to wrap this up, Tammy, do you have anything else you'd like to add?
Well, I would just say, as far as the voting, I requested my absentee ballot and already mailed mine in. It was a very simple process. We worked with the Rodney Scott, the sheriff's office, contacted me, and I've been working with him, with the clerk as well, to assist them with the processes on that day, as far as how to sanitize, and just working with them on supplies so that there will be ample supplies there for those that are in line and that they're social distancing and so forth. But that's very important that we all do that, and I've already mailed in my ballot. I would just add that it was a very simple process. But just as final words, I would just say, the closer that we stay within the guidelines, what the Pike County Health Department has recommended, that we hear from experts like Dr. Fadi all across and others, is in alignment with what the State Department of Public Health has recommended, which is also in line with CDC, the Center for Disease Control, and World Health Organization. Those organizations, as far as recommending soft face coverings when in public, social distancing practices, good hygiene, washing your hands frequently, and we're all in alignment with what we're recommending. Some of it's just good common sense, but as closely as we can adhere to those suggestions and those guidelines, the quicker that we will get through our phasing, our reopening, and the safer that we'll get there. So.
Thank you. Philip?
Yeah, the only thing that I would add to my earlier comments was when the pandemic began and we closed our offices, we added a number of services so that people could still complete their business with the city very easily. All of those services remain in place now, so don't feel like you have to come to City Hall to accomplish those things. You can continue to pay online, over the phone, meet our building inspector in the field.
Thank you very much. Doctor, I just have one question to close this out. There are still a lot of people, and particularly on social media, that question whether COVID-19 is really a threat, who would say that it's no more deadly than the flu, it's no more contagious than the flu. You've taken care of several people who've been critically ill with this disease.
Right.
How would you respond to those people on social media who discount the seriousness of this disease or want to make a comparison to the flu or other viruses?
So regardless of the comparison or not, this is something novel, which is new. And this has been hit the United States big time as well as the world. And we have numbers basically can speak for itself. We have millions of people infected for COVID-19 across the globe, which means this is something recently contracted and affecting the whole world in a very bad fashion. So now the seriousness of this illness, definitely this is a serious illness that can carry high mortality, and the mortality of COVID-19 much higher than the flu. But let's talk a little bit about the disease by itself. So this is an upper respiratory illness, can affect the lungs as well, and can lead to drastic consequences in some people who have some sort of underlying illness. So people, they have to believe in it. So this is not something that we made. This is something that hit us big time, and we're suffering from these consequences. This is a serious illness. This is easily contracted. Now, we're a little bit protected because of the summertime and because of the weather, but my biggest concern that when you go to the wintertime, are we going to have some sort of seasonal problem? That's something we don't know. So we need to wait and see exactly how things will go. But I highly recommend people, especially now in the summertime. Our Eastern Kentucky area is so scenic, so a lot of outdoor activity. Enjoy the summer and do it safely. And now regarding the voting, regardless of the method of voting, please vote. This is very important for our area, but do it safely. If you decide to come physically to the center and vote, make sure that you follow all the guidelines to protect the voters, the people in place when they do the voting, and we appreciate you all voting for that.
Thank you, Doctor.
Yes, sir.
On behalf of the Pike County Fiscal Court, I'm Ray Jones. Thank you for joining us, and we will give an update as needed if we see any changes in the number of cases, and also we'll be issuing press releases or otherwise updating the public as Pike County facilities are reopened. Again, thank you for joining us, and I would like to thank Philip Elswick, the city manager, and Tammy Riley from the Pike County Health Department, and Dr. Fadi from Pikeville Medical Center for joining us here today. Thank you.